Close to 100 women across the state of Indiana died while pregnant or soon after giving birth. That is according to the state's Department of Health. Those are the latest numbers available from 2020. And what's even more shocking is close to 80% of those deaths could have been prevented. WRTV's Meredith Hackler talks to the women pushing to turn this around.
It's a growing problem in Indiana. Women dying during pregnancy or not long after giving birth. Ariana McGee knows firsthand how scary not being listened to by a doctor can be. She says she almost died giving birth to her daughter last year when she knew something was wrong.
I had to advocate for myself and my mom too. And thank goodness, because she finally let up. She finally called my doctor. When my doctor was notified, she took me back to the operating room. She opened me up and she uncovered that I had a uterine window, which is essentially a thinning in my uterus. And it was so large that you could see my daughter's hair.
According to the Public Policy Institute at Indiana University, Indiana has the third highest maternal mortality rate among all reporting states. Not a shocking figure to mom of 7, Paradise Bradford.
I had my first child when I was 15 years old and had my last child when I was 30. So between those seven births, I had all 7 C-sections and wasn't really educated about the risk that was taken until my last pregnancy.
Both Bradford and McGee have different experiences, but each attended the Women for Change State of the Woman Conference to be part of the solution. Bradford has taken her lived experience and created a nonprofit to help teen moms and dads. A portion of what she does is educate teen girls about pregnancy complications.
The tools that they get from us is definitely there to make sure they can advocate and to save their life, because it takes one moment for you not to go to that emergency room because you think it's not as worse as it could be, and it can ultimately take your life.
For McGee, she's created a new piece of healthcare equipment that is just for pregnant women, which focuses on preventative care.
What we do is we compile all this data and easy to read trends and alerts for the care team and those physicians to intervene with those patients before a catastrophic event takes place.
And while each of these women are doing what they can to be part of the solution, they and Women for Change hope policymakers will take note.
So we're gathering information, but information should propel us to action. Without action, it will not be helpful.
In Indianapolis, Meredith Hackler, WRTV.
Indiana has the third worst maternal mortality rate in the entire country, but in the U.S., the United States has the highest maternal mortality rate among developed countries and is the only developed nation in which that rate is rising.